How do advanced methods help diagnose STI symptoms? Imagine catching an infection early before it causes serious health problems. Advanced diagnostic methods are making that possible by helping healthcare providers identify sexually transmitted infections more accurately and quickly. These methods are especially useful because many STIs can have mild, unusual, or no symptoms at all, making them hard to recognize just by physical signs. One of the biggest improvements comes from molecular testing, like nucleic acid amplification tests. These tests look for the genetic material of bacteria or viruses causing STIs, such as gonorrhea and chlamydia. They are incredibly sensitive and specific, meaning they can detect tiny amounts of infection even if symptoms are not obvious or have not yet appeared. This reduces false negatives and helps catch infections early. Rapid testing is another game changer. It allows healthcare providers to give results during the same visit, so treatment can start immediately. This quick turnaround reduces the chance of spreading the infection to others and prevents complications that can happen if an infection is left untreated. Next-generation sequencing is a more advanced technology that reads all the genetic information in a sample. It can identify exactly which pathogen is causing the infection, even if it is a rare or unusual strain. It can also detect if the bacteria or virus is resistant to certain medicines, guiding doctors to choose the most effective treatment. Although this technology is currently more expensive, it offers a detailed look at complex infections. Emerging methods like CRISPR-based diagnostics use gene editing technology to detect pathogens with high precision. These tests are highly specific and sensitive, and they can be performed quickly, sometimes even outside traditional labs. This makes them promising tools for early and accurate STI detection, especially in places with limited resources. Microfluidic devices, often called lab-on-a-chip technology, combine multiple testing steps into a tiny, portable device. They requiring small samples and can deliver results rapidly. These tools are especially useful in remote areas or clinics with limited space and equipment, making STI testing more accessible. Multiplex testing is another advanced approach that can check for several STIs at once from a single sample. Since many STIs can occur together or have similar symptoms, this comprehensive testing saves time and ensures nothing is missed. At-home testing kits are also part of these innovations. They let individuals collect samples privately and send them to labs for analysis. When combined with sensitive molecular tests, these kits help people detect infections early, even if they do not notice symptoms. This can encourage more people to get tested and seek treatment without stigma or inconvenience. All these advanced methods align with current health guidelines that emphasize early and accurate detection of STIs. They support traditional symptom recognition by providing objective laboratory confirmation, which is vital because many infections can be silent or have vague signs. Of course, these technologies do not replace the need for a healthcare professional's evaluation. Doctors interpret test results in the context of your overall health, risk factors, and symptoms to determine the best course of action. They can also provide counseling and follow-up care. In summary, advanced diagnostic methods help identify STIs earlier, more accurately, and more comprehensively. This means quicker treatment, less spread of infections, and better health outcomes. If you suspect you might have an STI or want to be sure, consulting a healthcare provider for testing is always the best step to protect your health.